Welcome to our very first episode of Season 2, Everyday Epidemics. I'm joined by Sidnee Hedrick. She's a PhD in pharmaceutical sciences, and I'm super happy for her to join us on the podcast today and for all the rest of Season 2. Really what we're going to focus on in this season is all about
what is prevention and how does it work in our community? What do we do? How does our work work, right?
My name is Mitchell Kilkenny, and I'm a tobacco prevention specialist. That means I do tobacco prevention, I do tobacco education, I go to schools, I build programs. I do a lot when it comes to tobacco prevention. What kinds of things do you do, Sidnee? Who are you?
I currently am the manager of Adapt Integrated Healthcare's Prevention and Education Program. We're out there in the community trying to prevent addiction, really is our sole focus. Substance use disorder, gambling addiction. We also get a lot into the mental health prevention too as well, and suicide prevention. So all of those important aspects. Really how I got here is a little bit different. I mean, everyone takes their own path towards prevention and all of a sudden realizing this is an actual field of science, right? I didn't know that when I first joined prevention. As you mentioned, I have a PhD in pharmaceutical sciences. I was very interested in helping people through science. And so that was the initial path I took. Unfortunately, what I realized is I didn't feel like I was having that direct impact of helping people that I was really seeking. Through my research, which was a lot of opioid research, trying to find treatments and overdose agents, overdose reversal agents, what I discovered was, man, we are doing a lot towards the treatment side, which is great. We need great treatments. But how much more could we impact our society and our local communities if we had more prevention, if we worked upstream and stopped the addiction before it started? So that's when my career kind of took a turn, and I was really excited to join ADAPT's prevention team. Now we work that upstream model, trying to prevent people from starting using substances or preventing them from down a path towards using them so excessively that they might develop some sort of addiction or substance use disorder. But truly, at its core, prevention is trying to stop something negative from happening. So whatever that negative outcome you're trying to avoid, what measures do we take to avoid it from happening, right?
Yeah.
So it can be health related, like those examples we gave. It can be completely non-health related, like we don't want our car to break down, so what do?
Regular maintenance.
Exactly. We go get our oil changed, we get our tires rotated. So there's lots of things we do and we practice all the time because we know if we don't do it, there are potential negative consequences. And that's really the core of what prevention is.
These are the things that we do in our daily work, which is to get folks to, to try to practice these little habits. I mean, I know in tobacco prevention, a lot of what I focus on is with parents. Like we talked about having that conversation early, knowing what to expect. It'd be like trying to drive a car at 3 years old and not having any idea. It'd be like, how am I going to get behind this wheel and drive? And you're not set up for success at all.
Yeah, definitely. It's putting into practice those small steps, those small actionable items, but doing it intentionally. So sometimes we don't necessarily know why we do things. And that's the great thing about this podcast we're going to go through together. What is the science of prevention to prevent addiction, and how do we do it in a way that's effective, right? And it makes sense for our community and it matches our needs. And when we do all of those things, we actually have the intended outcome that we want, which is to prevent that disease.
I think what's great about all of this is that it's backed and rooted in science. I mean, we have studies, we have what we'll go through today, which is the framework that we know this stuff works. Like we see better outcomes when prevention is implemented in the correct ways.
This whole podcast is going to be us going through with you, hopefully too at home, understanding in the context of behavioral health specifically, how do we prevent substance use disorder? How do we prevent addiction? And going through these tools that we have. The strategic prevention framework is one that we're really going to focus on, and we'll dive into that, piece by piece in future episodes.
What's like a general outline of the prevention framework, and what are some of the steps that people kind of go through?
Yeah, so There are 5 core steps to the strategic prevention framework. It's often represented in this like kind of flower petal to show the 5 steps. It starts with assessment, which is all about what's going on in the community. What are the needs? What are the problem behaviors that we're seeing? For
Right.
example, maybe like we notice vaping is increasing in our community. Okay, so that's an assessment we've done. We've got data to back up that that's a problem.
Yeah, you can't ever address anything without understanding, is this actually an issue or is this not really an issue?
Exactly. And then the next step is capacity. So lots of people think capacity is like, what are your means? What's your money? Who's helping? Which is so true. That's part of that capacity piece. It also includes the community readiness and buy in. So maybe we want to address vaping, but if the students are the ones that we're trying to reach and our schools don't recognize that it's a problem as well and aren't willing to work with us to educate them,
Yeah.
then our capacity is low, right? And that's a
Right.
barrier to our prevention work.
And I think even back in the day, like seatbelt, right? Seatbelt laws, you can probably remember where there was not a lot of capacity. People did not want seatbelt laws because it was
Yeah.
like, this is our infringement on our rights and all of these things. But if we think about that today, it's like, well, you should wear a seatbelt. Of course, you must wear a seatbelt. That's the best way to do it.
Yeah. So getting that buy-in, that community buy-in to actually be able to implement something is a big piece in that framework. And then the next petal to our flower is the planning. So that's okay. We've identified the problem. We have our resources. Our community is ready, truly ready for change. Now, what are we going to do about it? And that's the planning piece. What evidence-based practices can we implement? Which then leads us to the 4th step, which is implementation, actually doing the work, right? And then we follow that up always with an evaluation. Did our program work? Did we get
Right.
the intended outcomes we want? And we start over. We adjust as we go. If things are working great, if we need to change course because we did not get the outcomes we wanted,
Yeah.
we do that. And that's why that evaluation piece is so important.
And that's what's great about all of this work is that we understand that things aren't always perfect. We plan for the best, we hope things go well, but sometimes things don't work quite as intended. And it's good to say, oh, you know what? I tried really hard, we worked really hard on this, but it didn't quite work out. What can we do better?
Right.
How can we fix this? How can we go back through? You know, we don't ever promise anything, but we do our best to get these big outcomes. Are there a couple of examples of how prevention has worked like really well in our society? I mean, I think of one, which is sanitation. I mean, sanitation is like the very first thing that you do. They call him the father of public health, but John Snow back in the 1800s realized that people were dumping sewer water in their drinking water, and people were getting cholera and getting super sick. And he's like, "Hey, we gotta maybe not do this."
Yeah.
And what do you think people did? They were like, "Heck no, man! I would dump my sewer where I want to dump it."
Other ones I can think of too are one we can relate to, like our legal drinking age. Raising that legal drinking age is a prevention practice
Yeah.
at the legal level
Mhm.
by limiting access of alcohol to young people whose brains are still developing and
Yeah.
are at higher risk of developing an addiction to alcohol. So some of those policies that are put in place, we don't actually necessarily think that's a prevention practice, but it really is.
So we've talked a little bit about prevention in terms of substance use, but what about that mental health kind of angle? I mean, is that different?
Well, in general, the idea is the same, right? We're going to
Mhm.
identify actions that we can take to prevent the disease from happening, the behavioral health problem, the addiction.
Yeah.
So, what could some of those actions be, right?
Mhm.
Like, just briefly, some examples. If we want to prevent individuals from having an alcohol use disorder, well, kids, for example, let's limit their access. We just talked about raising that drinking age. But even at home, what
Right.
can parents do to lock up their liquor and liquor
Mhm.
cabinets so that they're less likely to be able to access that alcohol?
Yeah. Or just have those conversations.
Yep. Conversations are huge when it comes to youth understanding, first of all, the dangers that come from using substances, but also parental influence is like really huge.
Yeah.
And I think we underplay that a lot. Like
Mhm.
we think, oh, we don't really have a lot of influence on our kids. They're going to do what they want. But research continues to tell us that our parents' expectations and influence is the number one reason why kids choose not to use substances. So we got to keep that in mind
Yeah.
when we're setting like our household expectations and norms. and knowing that we have a lot of influence in what our children decide to do.
Absolutely. I think for most kids, their parents are their role models, they're their heroes.
Yeah.
And it's so important as a parent to understand what is that role. And I think a lot of parents, especially younger parents, maybe have a understanding that I probably should have these conversations, and I know this is probably the good thing to do, but then to actually take that step and do it, that's really a tough part. It's hard to have those conversations. It's hard to have that talk. Be like, hey, so let's talk about sex, or let's talk about drugs, or let's do these
Mhm.
things. If you're not in this field of work and don't have a solid background in some of this, and maybe you don't know a lot of it yourself, so how do you have those conversations? I think that's probably something we'll talk about in the future too.
Yeah, definitely. We could definitely do a deep dive into that. But that is something, it can be uncomfortable if you don't feel equipped with the knowledge to share. And that is a great conversation I'm sure we'll have at some point in this podcast.
Yeah. The other thing that we should talk about too is like protective factors and risk factors, right? There's these two
Yes.
sides of this coin. How does that fit into this whole prevention sort of model?
Yeah, so risk and protective factors are really what we're trying to balance when it comes to preventing behavioral health concerns. So, what are they? First of
Yeah,
all,
what yeah.
risk factors are these things that we have in our life that are going to increase one person's likelihood of developing some sort of negative behavior, or in this case, like developing an addiction.
Mhm.
On the other hand, protective factors are those that are going to protect us or reduce the likelihood of developing an addiction or a disease or whatever negative behavior that might be. Here's my example. I've got Leo the lion here, who we're going to say is a teenager in high school. And he's going to have already lots of risk factors and protective factors in his life in place. So you can see on this side, there are several risk factors in his life that are going to contribute to risk and possibly the development of a disease or addiction. And then on the other side, we have lots of protective factors, and those are going to contribute to protection in his life, mitigating some of that risk and hopefully avoiding negative outcomes and behaviors in his life. What could some of these risk and protective factors be for Leo? Maybe he's a freshman, he's entering high school, he's joined a group of friends that he's realizing actually vape pretty regularly before school, after school. That's going to be peer use of substances, which is a risk factor in his life. So we're going to add risk to his life. Another risk, there are lots of norms in his school. Vaping is okay. Like, I think a lot of my peers vape. There's this kind of understanding or perceived understanding that it's regular, everyone's doing it. This is a risk factor. The more risk factors that are in Leo's life, again, the more likely he is to develop that disease or addiction. And it leads him or tilts kind of this scale. We think of it like a scale towards that risk. If we want to balance this out, which is what prevention is all about, there are two ways to balance a scale. We can remove the weight from one side, which will balance it out, or we can add weight to another side. For Leo's life, if we want to work on removing risk from his life, we could maybe as a parent encourage him to find friends that don't use substances, right? That's going to remove one of his risk factors. As prevention specialists, what can we do? Well, we can help with the norms piece and helping kids understand, hey, you might believe that most kids are using substances or most kids are vaping, but did you know, based on you guys' reportings, that most kids aren't vaping and using substances? And that matters because the whole idea of wanting to fit in is really where we end up using those. Now understand that fitting in actually means not using substances. That removes risk, right? So it changes that norm. This can tilt Leo's path or direction in life back to protection. Again, another way to tilt him more towards protection is to add protective factors. So what could that be? We already said one of them was to add positive peer relationships. So that could be a protective factor. Maybe he has a coach. He's on a sports team and he has a coach that's a really great mentor. That could be a great protective factor in his life. Maybe he has strong coping skills, right? So he's become really resilient, and that's more protection. And the more protection we can give Leo, the more likely he's going to make healthy choices, engage in healthy behaviors, and avoid these negative outcomes like addiction. When we're talking about our role in the prevention field, and really anybody's role as a partner, as a parent, a community member, trying to find our piece in reducing risk factors and increasing protective factors to help Leo or anyone in our community make healthy choices and stay safe, that's really the goal of prevention.
Thanks for that demonstration, Sidney. That was really great. I think it really helps demonstrate kind of that visual representation of what those risk factors and protective factors mean and what they do when you take one away or add one and all the in-betweens.
Yeah, and it's really going to matter when we get into future podcast episodes and start diving into this strategic prevention framework, because we're going to keep referring to these risk and protective factors and how they play a role in identifying what strategies we use in our communities based on what risk and protective factors we can influence.
On our next episode, we're going to explore the strategic prevention framework in a lot more detail, so stay tuned to learn more about that.
We want to make sure this podcast is really engaging. It's something that folks in our community are interested in tuning into. So we do have a brief survey that you can click on below. And it's just very simple. 3 questions. Was today's episode engaging? Did you learn something new about prevention? And do you want to play a piece in prevention in our community? Do you want to help the cause? And by answering those 3 questions, you're going to be entered into a drawing for a $20 Dutch Roast gift card.
Woohoo.
So yeah, take the time. Really, it will just take a few seconds to fill that out. We will announce the winner of that gift card at the beginning of next episode.
Absolutely, because we would not be good prevention specialists if we didn't evaluate how we're doing.
Exactly. That's that evaluation piece.
It all ties in. Well, thank you again for listening today, and we will see you next time on Everyday Epidemics, Partners in Prevention, Episode 2.
Thanks, everybody.